Hi Vicky.
Hi, Mama Fitness.
I'm so excited to be here. I train women. I've worked with women for the last 3 years, and it's been an amazing journey. Yeah, and the time I've worked out with women, I not only train them to keep fit, but I train them to also take care of their bodies and also to take care of their mental health, because I realized if you take care of your body, then how about your mental health? So during this period of 3 years working out with women, I realized there are issues that women have when I'm working out with them, and one of the main challenges is pelvic floor, me being included, because I've also experienced it during my pregnancies, and I would say from my third pregnancy. So basically, I'm a mother of 5 boys. Now I'm 6 weeks postpartum.
Wow, that's nice. Congratulations.
Thank you. My boy is just 6 weeks, and so because now I'm ready to work out and all that, but I realized it's not all about working out. I also need to take care of my pelvic floor muscles, and because everyone is thinking about losing weight, and right now, like, I've added almost 13 kgs, so my mind is thinking about weight. But you know what? I don't think it's all about weight. It's all about my internal organs, which are also very important. So basically, when I was working out with women, I've had clients who've had issues with leakages, and since I'm not a specialist,
Yes.
I thought, why can't I look for a specialist who we can work with and create awareness on pelvic floor? And Vicky, I am so excited to to work with you and also come so that you can also train me as you train other women on pelvic floor. So basically, I'm a mother of 5 kids, and I'm excited to walk this journey with you.
Wow.
Yeah.
Welcome, Mama Fitness.
Thank you.
And I'm happy that you made a decision to come and take care of your pelvic floor. I'm a pelvic floor specialist dealing with women health, and it's something which is really in my heart, and I've done it for the last 7 years as a women health specialist, but as a physiotherapist, I've worked for the last 18 years.
Wow, 18 years.
Yes.
Wow.
So
Tell me, why did you decide to deal with women health?
I decided to deal with women health because in my course of practice, I could get women who were suffering from these issues of incontinence, issues of pelvic pain, and most of them, when they come, sometimes we just think of pelvic floor is Kegels. And that is basically what we are taught even in school. Yeah. But when you get out of the field, you realize it's different, and you sort of like have to advance and do specialized courses to be able to tackle the problems well.
Wait a minute. What is pelvic floor?
Pelvic floor, I want to look at it from explaining it to you that pelvic floor, it involves muscles, it involves ligaments, involves nerves, and we also have connective tissues. So you look at it...
All right, let me cut you short. Do you know, at first I thought pelvic floor is just about the vagina, the urethra, but I didn't know it includes the ligaments and all that.
Yes, pelvic floor, we usually have the external bit, which of course somebody will look at you and think your pelvic floor is your hips. But pelvic floor, it basically involves all those muscles, ligaments, and the connective tissues, and even nerves. And when you look at it, I want you to take a picture of trampoline. A trampoline, it has 4 ends. So it has the front and it has the back. So the pelvic floor, that's where it is constructed, that's where it is. So the front and the back, the pelvic floor muscles are supported by the back, it's the tailbone, and the front, it's what we call the pubic. Okay. And then we have the 2 bones which basically support the pelvic floor, and the pelvic floor moves up and down, up and down. So it's just like a trampoline. When you look at the trampoline, the way a trampoline moves, that's the way the pelvic floor moves.
Wow, So it's very flexible.
So it's very flexible, and that's why it can stretch during childbirth to be able to accommodate the baby passing.
Sorry, Victoria, I'm excited about this because I'm getting to learn a lot of things from you. When I got married and when I got my first pregnancy, during childbirth, I was asking myself, how is this baby going to come out? Because no one prepared me that there's the contraction part of it. So when you talk about the pelvic floor, I'm thinking how the muscles are, but I'm not a specialist. That's why I need you to train us more.
Most of the time, the first time I do, even with my clients, is to make them understand how the pelvic floor is, how it looks, how it works, and that way helps them to understand. Even when we are walking the journey of the exercises, they know very well on what are they dealing with.
Okay.
So most of the time when you look at it the way I was explaining, it's here we have the symphysis and here we have the tailbone. So these here, we have the urethra here, we have the vagina, and we have the anus. So all this is covered by muscles. They're not just holes which are on their own. So they're supported by the muscles, and we have the pelvic bones which support them on the side. So the pelvic floor, it's covered with all the muscles. We have so many muscles. We have muscles which are in the first layer, which basically try and just close the sphincters. So those ones, the sphincters is the holes. That's the vagina, the urethra, and the anus is surrounded there. So it's sort of like it's the one which helps in just closing. So those are the muscles which are just in the first layer. And that is why most of the people will say that they're doing Kegel, but they're still not getting better, just because when they're told to squeeze, the only thing they do is to try and close the hole.
Oh, really?
Yeah, but then we have the second layer and the third layer, which basically is the one which helps in supporting the bladder.
Wait a minute, there's something I didn't understand there.
Yes.
How do they close the hole instead of working on the muscles?
They're muscles. So basically this is the hole, and this hole is surrounded by the muscles. So by the end of it's like when you're told to close it, then you're able to do that. So that's the first layer which does that.
Okay.
And then now we have the second layer, which basically is the one which supports the internal organs. When I talk of internal organs, I'm talking of bladder, I'm talking of uterus. So it's the one which supports.
Okay.
I'm talking of the bowel movements. So it supports. And that's why we look at the pelvic floor as the base, as the base of the body.
Wow.
Foundation. It's a foundation. Actually, I call it the foundation.
Wow, because it holds everything.
It holds everything there. So if it is not strong, then it interferes with so many things. Actually, if it is weak, first thing it does, it interferes psychologically.
Yeah. Self-esteem.
Self-esteem. Even posture. Because when you sit, you don't want even to sit upright because you don't know what time it is going to come out.
Wow.
It also interferes emotionally so much. So we call it the foundation of everything. And that's why even most of the time when people are suffering from pelvic floor issues, they also have so many issues at home. Because it's the base of everything.
Wow.
If people are not really active, their pelvic floor is not active, then they're not even interested in sex. So that is one function of it.
So what do you mean? What do you mean by active?
If the pelvic floor muscles are weak, looking at a scenario whereby even a woman is leaking, or they are not really able to feel their pelvic floor muscles, and that is very common after childbirth. So most of them you find that they're not interested in sex. And it is easy, even when their partners ask them for sex, they sort of like shy away and they give excuses. That is one common issue which is affecting most of the marriages. So, and since women are not even taken through to be able to understand what they are supposed to do after childbirth or how they are supposed to take care of their pelvic floor muscles, then most of them end up getting very depressed.
Oh my. You know, you're talking about this, and I'm here and I'm thinking, like all my pregnancies, I've had to read on myself because now I'm a fitness trainer and I train mothers. I've had to read on myself about pelvic floor muscles and how I should do exercises to make them stronger. But now when you talk about pregnant women after childbirth, they've not been prepared on how to take care of their pelvic floor muscles.
Yes.
It comes to my mind and I'm thinking, why are we not trained at the hospitals? Or why are we not prepared for that?
The reason is because most of the hospitals, they tend to look at it in terms of how to take care of the pregnancy.
And the mother and the baby.
And that's all. But how to take care of the mother after delivery, it is never factored in. How it's only factored in what the baby should be done. That's why when you're being discharged from the hospital, you're told come for clinic. When you go back for the clinic as a mother, what is done to you?
Wow. Well, just a normal review to check if you have any clots, if the blood is still coming out, or if you have any pains, pressure.
Yes.
But I've never heard of how is your pelvic floor muscles.
Exactly.
Wow.
So that is basically one factor which really affects. And it's something which is not looked at. And that's why it's very important all the mothers to be trained on how to take care of their pelvic floor post-delivery, because those muscles really stretch too much for a baby to be able to pass through. You can imagine those muscles, how much they have stretched.
And the baby is big.
And the baby is big. So what happens?
Yeah, and I'm also thinking, how about the mothers who are not able to access good hospitals?
That's why we have so many cases of even mothers who have fistulas, mothers who have incontinence, that is just the leakage.
Okay, hold on there, Victoria. First of all, tell me, what are the pelvic floor disorders?
Pelvic floor disorders are very wide. There are many. I'll tackle a bit of them, but it's very important for you to be able to understand them, because even in your training as a fitness therapist, you'll be able to guide the mothers, because somebody will come and tell you, I'm feeling things, I'm feeling this. And once you understand it, it will be very good also for you in your line of duty. So most of the disorders which mothers experience, first one, it's what we call incontinence.
Is it mothers alone or even other women?
It's women. Okay. It's not really mothers alone.
Okay.
Because some issues like incontinence will affect even young people.
What is incontinence?
Incontinence, it's basically passage of urine leakage. We call it leakage.
Okay.
Yes, so that's an easier way of explaining it. And leakage can be in different forms. We usually have what we call stress incontinence. We have urge incontinence. And we have what we call mixed incontinence, and we have complete incontinence.
We do want to break down.
So in breaking down, when I talk of complete incontinence, it's basically somebody just urine passing without them actually realizing that it is passing. They don't have control over it.
Really? That's
yes.
sad.
Yes, it is sad because one has to keep on wearing pads just like the way we do when we have periods. And it is usually very frustrating, and you imagine emotionally one will just feel like I'm smelling. Even if somebody is not smelling, you actually feel it. Psychologically it is there. So that's what we call complete incontinence. Then when we talk of stress incontinence, it's very common with mothers who work out.
Like me?
Like you.
Well, not me. I've been working out with my pelvic floor muscles. At least I've been working out. Well, thank you for mentioning that, because I believe there's so many fitness women trainers who do not take care of their pelvic floor muscles.
Exactly. They are, even the athletes, it's very common in them. And the stress incontinence, it's basically involves when you cough or sneeze or laugh, when the urine leaks.
Even when you're not pregnant.
Even when you're not pregnant.
Wow. You know, for me, in my third trimester, when I was almost scared of my baby, that's when sometimes I'll sneeze and I'll feel, oh my God, I feel like peeing, and I would rush to the washroom.
Yes.
And then I would ask myself, why is it that? So I thought maybe it's because of, maybe one, I believe it's because of the pressure that the baby is putting down.
That is true.
Yeah. But also.
But number two, it's also possible that your pelvic floor muscles are also weak.
Yeah.
There is possibility that yes, because you've been just be reading in the internet and all that on what to do, you've been exercising only the first layer, and maybe you've not targeted the second and the third layer.
Wow.
So I basically need to make you aware of, first thing I usually deal with my clients is making them aware of their pelvic floor.
Wow.
That's usually
Stress
the first stage.
incontinence.
That is now stress incontinence. Now, when you talk of urge incontinence, it's when somebody, the bladder is full, but you cannot be able to hold it. You feel you need to go and pee, and if you don't rush to the toilet immediately, then the urine leaks, comes out. I'm sure you've gone to most of the places where you go and find women trying to dance at the front of the...
One of my friends used to do that, and I'm asking her, why is it? Because she's just like, I'm thinking, what is not happening? Why can't you just go to the ladies? And she's like, I'm surprised. And she's just there, she's not moving.
Yes. So they usually try to dance. And now actually the worst thing is that for such a person, if in any case the person who is in the toilet tries to open the sink or they hear the water flowing, it basically just comes out without them knowing.
So it's psychological as well.
It comes out because now the action of trying to dance, it's basically to try and disrupt them from disrupt the movement, the leakage. So there is that urge incontinence, and at the same time there is what we call overactive bladder. Overactive bladder can also bring the urge incontinence. And overactive bladder, it's basically when the bladder is too sensitive that it cannot be able to hold urine, the required amount of urine fully. So you tend to get somebody going to the toilet frequently. Okay. And that overactivity of the bladder basically comes when the pelvic floor muscles are tight. And now, in such a case, if somebody just reads in the internet and thinks that I'm only supposed to do Kegel exercises, then that person is doing the wrong program. And they say, I've been doing all these Kegels and they are not helping me. But the problem is they're giving wrong dosage for the wrong problem.
Really?
Yes, because the bladder, when it is overactive, then it shows the muscles are too tight. So I've told you, it looks like a trampoline. So the muscles are too tight here, so they're squeezing the bladder. And then you continue squeezing them. So you're not going to help the situation gets worse. So
wow. I mean, there's just so much that we don't know about.
Yes, so that is one. The other thing is that you can have something we call prolapse. Prolapse, it's basically a descent of the organs, on the internal organs, and they block the vagina.
How do they descend?
So they descend because the pelvic floor muscles are weak. I've told you they're able to move down and up. So when they become weak, they descend. And because one of the function is to support the internal organs, then the internal organs also descend and get into the vagina. So you can get the bladder descending and blocking the vagina. You can get the rectum also descending.
That must be very discomfort.
And blocking the vagina. Yes, it's a lot of
Brings a
discomfort.
lot of-
It
yeah.
brings a lot of discomfort, and most of the women will say that I actually feel like there is something which is falling. There is something falling in my private part. There is something blocking. That's the kind of words they use. There is something blocking. So, and I'm very uncomfortable.
Yeah.
So in such scenarios, you will get maybe, and it goes with the degrees. There is always the first and second and third degree. So if it is just started, we are easy to reverse it with the exercises. But if it is at a certain degree, second and third, we might end up referring to a surgeon for a surgery, and then now we follow up later. Now, the other condition which I look at, which I get also, it's what we call fecal incontinence. Fecal incontinence, it's where the stool comes out. And it just comes out. Sometimes some people don't even feel it. Others, they just realize that I was walking, I feel like a fart, and then they release it, but they realize the stool has come out. So it happens, and I find it is usually very common with the people who practice anal sex. It's very common, and sort of like brings the self-esteem really down. You can imagine when the stool is coming out, how uncomfortable it is.
Very uncomfortable.
It's very uncomfortable. So the other thing I've also experienced is something we call vaginismus. Vaginismus, it's basically...
Vaginismus?
Yes. It's basically pain on penetration.
Okay. When you're making love.
When you're making love. Then you realize that there are women who get a lot of pain during sex. And sometimes one might not really understand it. Even the women will try to explain to their partners, and they cannot really understand, how are you having pain when you're supposed to be enjoying? That's a question they ask. But
is it psychological too?
It's not psychological. It is something which is the muscles go into spasm. And I've realized it's usually very common, and especially with women who have gone through psychological torture.
Okay.
It's very common. Even when they were young, you might get even like girls who have gone through rape. Rape cases, they experience vaginismus very much. Or girls who have been abused even by family. They have grown in a family where the setup is not conducive, and there is always fight, and there is, so they tend to sort of like tense their body. So they tense their body, and most of the time people only think that this girl is affected psychologically. She's tensed the muscles, but she's tensed so much even down there.
Wow.
So cases of sexual abuse, they usually have that. It's very, very common. Vaginismus can also be because of especially women who have gone through radiation.
What is radiation? Oh,
Radiation,
okay,
it's radiotherapy.
Yes.
Like cases of cervical cancer, they actually have that so much because of the pain. So the muscles go into spasm and they have hardened. So you sort of like have to train them, have to work on how to release.
Wow. Victoria, I mean, this is very useful information. Let me ask you, what causes these pelvic floor disorders?
Pelvic floor disorders, there are quite a number of issues which cause pelvic floor disorders, but one of them is childbirth. It's the most contributing factor. Yes, because during that time when you're pregnant, there is the issue of the hormones, which basically makes the ligaments and the tissues a bit loose and weak. And of course, that time the muscles and the ligaments are stretching. And most of the women also experience what we call perineal tears. They're very common with the normal deliveries. And then you realize that time, then during childbirth, when you're pushing, you really have to sort of like open nicely for the baby to pass. So you imagine if those muscles have stretched to that extent for the baby to pass, what brings the muscles back? So that is usually not addressed at all. So that is basically one cause. We say that many pregnancies can actually, so it's good for you to do proper pelvic multiple, because I know you are mother of many.
Oh, 5 boys.
But sometimes you can even only have one, and you actually get all those problems because of the prolonged labor.
Yeah.
The others will have very simple deliveries, others have very prolonged labors.
Yeah.
There is also
so in short, what you're saying is it's important for pregnant mothers to be taught on, they have to be prepared on how to take care of the pelvic floor muscles even after delivery.
Exactly. It's supposed to be part of the program.
Wow.
Just like the way part of immunization, part of checking how the baby is and the weight and all that, that should be part of it. It should be come together. So the other cause of the pelvic floor, it can be because of injury. Somebody can have injuries, maybe accidents and all that. Maybe you fell down and injured your pelvic bones. So that, because the pelvic bones are supported by the muscles, so that can also bring a weakness of pelvic floor, or if there is damage of the nerves which supply the pelvic floor, then you can actually get all those problems of leakage, you can get the problems of prolapse, because basically the nerve is the one which is supposed to be sending a message that the muscle need to contract, the muscle need to relax. But if the nerve is not functioning, then you get just somebody flowing and you don't understand and you can't feel it. So the other cause of it, it's obesity.
Really?
Yes. Other women who are big, who are huge, and have big tummies, even men who have big tummies, they have weak pelvic floor. That's why most of the time, even men, it's said that they cannot function well when they have big bellies.
So
Exactly.
oh my God.
Because their pelvic floor muscles are weak.
Yeah.
Because once you use, then it sort of like puts pressure.
Yeah. And Victoria, I used to think that pelvic floor muscles only affect women, but it's surprisingly that it also affects men.
Yes, that is a myth. That's what we call myths, because the men, they only structured the same as women. The only difference in the pelvic floor, the muscles are the same.
Yeah.
The only difference men have with women is that men, they only have 2 passages. That is the anus and the urethra, while women have 3.
Yeah.
That is the only difference in the pelvic floor. Nothing
All right,
else.
just give me 2 more causes of pelvic floor disorders, because we need to get to the part 2 of this.
So the other one is lifting.
Lifting what?
Lifting heavy weights.
Okay.
That can also cause weakness of the pelvic floor.
Really?
Because most of the time, the way they lift, you realize that they lift and they are holding their breath. And when you're holding the breath, then you're putting more what we call intra-abdominal pressure, which pushes
That's
the
very
pelvic
true.
floor down.
Yeah.
So basically, when you look at the causes, the other cause, I've said it's more of cancer issues. It really contributes to the weakness of the pelvic floor muscles.
Well, sorry, as we wind up this part, there's one of my friends who said that her mutual friend, when she used to have periods, her husband would always have anal sex, and I felt really sorry for her because she ended up having fistula, and I really don't know why men or why your spouse would push you to do that and it affects your health. I don't know if you've come close to such women.
I've come across such women, and it is very traumatizing because to me, I think that is just being selfish, that you want to satisfy their desire. And for sure, it really affects women so much because getting through the anus, sometimes you're not psychologically even prepared for it, and you get in, and that's how they end up poking the layer, because the anus and the vagina, it's only separated by a layer, a thin layer. So when they go in wrongly, then definitely it resorts to fistula.
This is so
And then
sad.
you hear somebody saying, I can hear passage of air coming at the front, or when I fart, I feel the hair coming out, or sometimes when I wipe myself, I get fecal matter in my vagina.
What is fecal matter?
Fecal matter is feces. Stool.
Oh, really?
Yes.
Oh, that is so sad.
So you get it there. So it's very frustrating.
All right, Victoria, let's hold it here. I'm excited. I'm really excited to work with you to create this awareness about pelvic floor. So I think we will break from here, and then when we get back to the part 2, we'll talk more about pelvic floor muscles.
Okay.
Thank you, Victoria.
Thank you too.